Hello, everyone, and welcome back to the CLSR, and I'm your host, the counselor. Now, we have been going through some pandemic, and a lot of the focus is on survival. However, we can't forget about our people out there who have some diseases other than the COVID 19. I'm talking about the STDs. Yes, the sexually transmitted diseases. We need to talk about them. We need to understand a little bit about it so that we can give some proper information in relation to the STDs. And I mean, it can happen to everyone. I mean, when I even talk about HIV, warts, all of these different, herpes, all these different STDs have taken a back seat to the COVID 19. At least we think they have taken it. It's still happening out there. People are still catching STDs. They're still not watching themselves the way they're supposed to. But what are STDs? Well, the term STDs is really a condition passed from one person to another through sexual contact. Now, you can contract an STD by having unprotected vaginal, anal, or oral sex, or with someone who has the STD. See, many of you have been led to believe that the only way to catch an STD is to catch it through sex. No, sex is not the only way STDs are transmitted. Depending on the specific STD, infections may also be transmitted through sharing needles and breastfeeding, right? And there are symptoms for men and there are symptoms for women, right? And it's possible to contract an STD without developing symptoms. But some STDs cause obvious symptoms, especially in men. Some of the most common symptoms in men could be pain or discomfort during sex or urination, sores, bumps, or rashes on or around the penis, the testicles, anus, buttocks even, the thighs, or the mouth. Unusual discharge or bleeding from the penis. Ooh, that sounds painful. Painful or swollen testicles. Ouch. Could you just imagine what that would feel like? Well, there are a number of people out there who have these symptoms. And these symptoms can also vary depending on the STD, right? We need to learn more about these symptoms, especially in men. I think we're going to talk a minute or two just about men with the STDs, and then we'll get to the women. But I think many men are quick to assume that if they had a sexually transmitted disease, they would know it. However, most STDs do cause symptoms. Many are easily mistaken for another condition, and some have no symptoms at all. So we need to understand the risks and knowing the signs and symptoms of the common STDs in men. This is very crucial for any man who is sexually active. Chlamydia. That is one of the STDs that is quite common. It's a bacterial STD that is transmitted during anal, oral, and vaginal sex with someone who is infected with chlamydia. It's one of the most common STDs in North America, right? There's about 1.5 million people infected with chlamydia, right? And this is, I think, since 2016. That was the last study that I've kind of looked over, and it said there were approximately 1.5 million people in the United States alone. Not in all North America, but just in the United States alone. Many people who become infected with chlamydia don't ever display symptoms. Others only begin to display symptoms several weeks after being infected. And some of these are for chlamydia would be the pain when urinating, the penile discharge, the swollen testicles, right? And there are less common symptoms that occur for chlamydia, like the rectal pain, the discharge, and the bleeding. Now, many of you have heard of gonorrhea. This is also a bacterial infection that can affect the anus, throat, or urethra. It's transmitted during anal, oral, and vaginal sex with a man or woman who has been infected. Most men with gonorrhea don't display any symptoms at all. But for those who do, Some would be that pain when urinating. Even a green and white or yellow discharge from the penis. So if you're having some green or yellow discharge from the penis, you could have gonorrhea. And also, what's less common in gonorrhea are the swollen and painful testicles, painful joints, right? Rash. If you get a rash, that could be a sign that you have gonorrhea, right? Hepatitis B is a form of hepatitis that is caused by the hepatitis B virus. Unlike other common STDs that can produce more obvious symptoms focused around the genitals, hepatitis B causes a dangerous inflammation of the liver. That's really scary for a lot of people. There are a number of people who have it, and they didn't just get it through sexually transmitted diseases. Some might have a blood transfusion, like if they were in an accident, they went to a hospital and they got tainted blood. Now, that's something that's quite possible. Needle exchange. There's all kinds of things that can happen, but people wouldn't understand that hepatitis B is not just through sexual transmission. Could be contact through other ways, like blood transfusion, as I mentioned. Some of the symptoms for hepatitis B are loss of appetite, feeling lethargic, having a low grade fever. You could have muscle and joint pain and aches, even nausea or vomiting may occur. Jaundice, which jaundice is like yellow hue to the skin and dark urine, right? Many people infected with hepatitis B won't display the symptoms at all, right? They often mistake hepatitis B for the cold or the flu, right? So it's a virus that will continue to damage the liver if it's untreated, right? Herpes. Now, many of you have heard of herpes, right? Herpes is a viral infection that is caused by the herpes simplex virus, HSV. And herpes may affect the mouth, oral herpes or HSV type 1, or the genitals. And the genital herpes, HSV type 2, this virus is transmitted through direct contact with the mouth or genitals of a person who has been infected with the virus through sexual intercourse or oral sex and kissing. While types of HSV prefer certain locations, either type can be found in either location. The symptoms of herpes can be difficult to spot. You see, many people won't have any symptoms at all. Those who do will develop blisters that are often mistaken for other skin conditions, like pimples, right? Symptoms often occur between 2 days to 2 weeks after the infection. The initial outbreak can be quite severe. And some of the common symptoms for herpes in men are like tingling, itching, or burning of the skin in the area where the blisters will appear. Blisters on the penis or testicles, or around the anus, the buttocks, or the thighs. Ouch. Blisters on the lips, tongues, gums, or other parts of the body. Aching muscles in the lower back, the buttocks, the thighs, the knees. Swollen and sometimes tender lymph nodes in the groin. Loss of appetite, fever, feeling unwell, right? Like this is serious. When you have herpes, it's like luggage. It goes wherever you go. All right. Now, there's another STD that a lot of people aren't really familiar with. It's called HPV. And I know that some young people get the shot, boys and girls. HPV is the human papillomavirus, right? And this is used to refer to a group of viruses that comprises more than 150 strains. While most of these strains are quite harmless, 40 are considered potentially harmful. These are classified as being either low risk or high risk strains. It's one of the most common sexually transmitted disease today. Most men and women will eventually acquire one strain of the virus during their lifetime, right? And there are approximately 14 million people, right, in the United States who have contacted HPV each year. And Currently, there are approximately 80 million Americans infected with HPV. Now, the low-risk strains may result in genital warts in some people, while in men, the high-risk strains can lead to cancers of the anus, the throat, and the penis. See, HPV can be transmitted through skin-to-skin contact with a person who has been infected with the virus and is most commonly transmitted through anal, oral, or vaginal sex. And some of these symptoms for the HPV, the most common symptoms, are genital warts, flat and flesh-colored or clustered of tiny bumps, described as having a cauliflower appearance. Warts in the mouth or the throat, spread through oral sex with an infected partner. Now, how do you prevent HPV? Or can you prevent HPV? Well, unlike other STDs, which can only be prevented through the use of condoms or by abstinence, HPV can now be prevented with vaccines. There are 2 HPV vaccines that have been approved by the FDA, Gardasil and Cervarix. They are both effective in the prevention of HPV, type 16 and 18, which are high risk and responsible for causing most cervical cancers, which is 70%, and type 6 and 11, which cause over 90% of genital warts. Now, there is a new version of Gardasil called Gardasil 9, and this protects against 5 more strains of the virus. Gardasil 9 was approved in the U.S., all right, in 2014, right? And eventually this replaces the old one. However, we do need to be aware that the original Gardasil is recommended only for females from ages 11 to 26. Gardasil has now also been licensed for use in boys and men age 11 to 21 to prevent genital warts. Syphilis. Now, syphilis is a bacterial STD that can be transmitted through anal, oral, or vaginal sex as well. This is an ancient disease, and it's still quite prevalent today. Syphilis is considered one of the more serious STDs in men because of its risk linked to HIV. You see, they say that if you have syphilis, you have an increased risk of catching HIV, right? And some of the common symptoms of syphilis, which has 4 different phases, would be the primary, secondary, latent, and tertiary. Each phase has its own set of symptoms, and the symptoms of the primary syphilis in men may include a very small, firm, and painless sore where the bacteria entered the body, usually on the penis, anus, or the lips. And then you have the swollen lymph nodes in the area near the sore, right? Symptoms of secondary syphilis may include like a skin rash that doesn't itch, commonly found on the palms of the hands or soles of the feet, tiredness, sore throat, headache, swollen lymph nodes. And the less common symptoms of syphilis, which is latent syphilis, is the stage that occurs after the symptoms of secondary syphilis has stopped and the STD has gone untreated. See, tertiary syphilis is the 4th stage. It's rare, as few people actually enter the 4th stage, even when the syphilis is left untreated. It can cause serious complications, which include damaging the heart, damage to the nervous system, including the brain, joint damage, and damage to other parts of the body. Syphilis can cause serious medical issues and death if it reaches this stage, the 4th stage, even several years after infection. Now, we heard about Al Capone, the gangster. He had syphilis. He ended up dying from it. So what could we do to prevent syphilis? See, we have to think of preventing STDs, period, not just one specific STD. Many people can be infected with an STD without experiencing any visible symptoms. This means that practicing safe sex is crucial if you want to prevent STD. The only way to completely prevent an STD is abstinence from any type of sexual contact or contact with open sores and bodily fluids or an infected person. But there are other ways to prevent STDs too. Condoms during intercourse and dental dams or barriers during oral sex are proven effective when used correctly. Refraining from sex with multiple partners and instead opting for a monogamous sexual relationship could also help prevent the STDs. Now, you don't need to put off your STD test. Don't put your sexual health off longer, right? Go get tested. You can even order the test online, but you need to get tested. Now, I was asked a simple question of, can you get an STD from a hand job? Well, the truth is you can get a sexually transmitted disease from giving or getting a hand job, right? Or other manual stimulations, as well as oral sex. So just be clear, for sure you can catch an STD from that. Skin contact, remember that, right? Not just fluid, skin contact. Now, when we talk about STDs in women, in many cases, STDs don't cause noticeable symptoms. When they do, common STD symptoms in women include pain or discomfort during sex or urination, sores, bumps, or rashes on or around the vagina, the anus, buttocks, thighs, or mouth, unusual discharge or bleeding from the vagina, itchiness in or around the vagina. See, the specific symptoms can vary from STD from one to another. So if you want to know about specific, we have to talk a little bit about specific STDs in women. Sexually transmitted diseases are also known as sexually transmitted infections, and they're passed through vaginal, anal, oral sexual contact. Female symptoms of an STD can include vaginal itching, rashes, unusual discharge, pain. Many STDs display no symptoms at all, left untreated in women, right? But STDs can lead to fertility problems and an increased risk of cervical cancer. These risks make it even more important to practice safe sex. Simply because many women don't show symptoms with STDs, they may not know they need treatment. It's estimated that as many as 1 in 5 Americans has genital herpes, but up to 90% are unaware that they have it. Now that's scary and concerning, right? Untreated STDs cause infertility in at least 24,000 women yearly in the U.S., and they can increase the likelihood of complications such as abdominal pain or ectopic pregnancy. So some of the common STDs in women will be the HPV, as I mentioned earlier, gonorrhea, chlamydia, and the genital herpes. Women should be aware of the possible STD symptoms so that they can seek some medical advice if necessary. And some of those symptoms would be changes in urination. An STD can be indicated by pain or a burning sensation during urination, the need to pee more frequently, or the presence of blood in the urine. Abnormal vaginal discharge, as we mentioned earlier. The look and consistency of vaginal discharge changes continually through a woman's cycle. Thick white discharge can be a sign of a yeast infection. When discharge is yellow or green, it might indicate gonorrhea. Okay. Itching in the vaginal area is a non-specific symptom that may or may not be related to an STD. Sex-related causes for vaginal itching may include an allergic reaction to a latex condom, a yeast infection, pubic lice or scabies, genital warts, the early phases of most bacteria and viral STDs. Okay, so pain during sex, this symptom is often overlooked, but abdominal or pelvic pain can be a sign of pelvic inflammatory disease, PID. And PID is most commonly caused by an advanced stage of infection with chlamydia or gonorrhea. Now, if you do find that you have abnormal bleeding, this is another sign of the PID, pelvic inflammatory disease, right? Or other reproductive problems from an STD. So if you have rashes or sores or tiny pimples around the mouth or vagina can indicate herpes, HPV, or syphilis, right? Prevention. Everyone should take certain preventative measures to avoid getting a transmitted disease. You just got to get tested regularly. Typically, women should get a pap smear every 3 to 5 years. It's also important to ask if you should be tested for any STDs and whether the HPV vaccination is suggested. You should talk to your doctor if you want to get some testing. Use protection. Whether it's for the vaginal, anal, or oral sex, a condom can help protect both you and your partner. Female condoms and dental dams can provide a certain level of protection. There's a indecisive people out there that say, they're not really that effective. However, it can prevent some transmission of STDs. Spermicides, the birth control pill, and other forms of contraception may protect against pregnancy, but they do not protect against the STDs, and you have to learn to communicate. Honest communication with both your doctor and your partner about sexual history is essential. I know some of you have the skeletons in the closet, but they got to come out when it comes to the STD, because if you don't tell your partner, your doctor's going to figure it out, and your partner is definitely going to figure it out. So you better start speaking before you get spoken to. Now, the STDs in pregnancy can be quite concerning. Women can get STDs while pregnant because many infections don't show symptoms. Some women don't realize they're infected. For this reason, doctors may run a full STD panel at the beginning of a pregnancy. These infections can be life-threatening to you and your baby. You can pass STDs on to your baby during pregnancy or birth. So early treatment is very, very, very important. And all bacterial STDs can be treated safely with antibiotics during pregnancy. Viral infections can be treated with antivirals to prevent the likelihood of passing the infection to your child. So there are things you can do. So we also need to talk about STDs and sexual assault. See, some women will develop STDs as a direct result of a sexual assault. When women see a healthcare provider immediately following an assault, the healthcare provider must try to capture the DNA and evaluate for injuries. During this process, they check for potential STD infection. If some time has passed since a sexual assault, you should still seek medical care. Your doctor or another healthcare provider can discuss possibly reporting the event, along with health-related concerns. Now, depending upon the person and their individual risk factors and medical history, the healthcare provider may prescribe preventative treatment, which could include antibiotics, a hepatitis vaccine, an HPV vaccine, and an HIV antiviral medication. You're going to have to continually follow up with your healthcare provider. So if you are diagnosed with an STD, you should start any treatment your doctor prescribes for you immediately. Contact your partner, let them know that they need to get tested and treated as well. Abstain from sex until your infection is either cured or until your doctor gives approval. In the case of bacterial infections, you should wait until the medications have cured you and your partner. For viral infections, wait long enough for your partner to be on an antiviral medication, if necessary, to reduce the risk of infecting them. Your doctor will be able to give you the correct time frame. Now, we need to talk about this term. It's almost like a street term people use called the crabs, which is basically pubic lice. Crabs is another name for pubic lice. They're tiny insects that can take up residence on your pubic hair, like head lice and body lice. They feed on human blood. Common symptoms of pubic lice include itching around the genitals or anus, small pink or red bumps around the genitals or anus, low-grade fever, lack of energy, irritability. You might also be able to see the lice on their tiny white eggs around the roots of the pubic hair. A magnifying glass can help you spot them. If left untreated, pubic lice can spread to other people through skin-to-skin contact or shared clothing, bedding, or towels. Scratching bites could also become infected. It's best to treat pubic lice infestations immediately. If you have pubic lice, you can use over-the-counter topical treatments and tweezers to remove them from your body. It's also important to clean your clothes, bedding, towels, and home. You got to understand, in order for you to get this pubic lice, you have to use preventative measures. So, what are pubic lice? Pubic lice, also known as crabs, are very small insects that infest your genital area. There are three types of lice that infest humans: head lice, body lice, or pubic lice. Lice feed on human blood and cause intense itching in an affected area. Pubic lice usually live on pubic hair and are spread through sexual contact. In rare cases, they can be found in eyelashes, armpit hair, facial hair. Pubic lice are often smaller than body and head lice. Pubic lice infestations are more common among people who have sexually transmitted infections. How can you get pubic lice? Well, simply put, they're transmitted through intimate contact, including sexual intercourse. It's also possible to catch pubic lice by using the blankets, towels, sheets, or clothing of people who have pubic lice. Adult lice lay their eggs on their hair shaft near the skin. These eggs are called nits. 7 to 10 days later, the nits hatch into nymph sands, start feeding on your blood. The lice can live without their food supply for 1 to 2 days. Contrary to common belief, you're highly unlikely to get pubic lice from a toilet seat or furniture. Pubic lice usually don't fall off of their host unless they're dead. They also can jump from one person to another like fleas. Don't allow your children to sleep in your bed if you have pubic lice infestation. Children may get an infestation after sleeping in the same bed as someone who has pubic lice. In children, the lice usually live in their eyelashes or their eyebrows. The pubic lice presence in a child might also indicate that they might have experienced sexual abuse. And you need to understand and recognize the signs and the symptoms of pubic lice. See, people with pubic lice often experience itching in their genital region or anus about 5 days after the initial infestation. At night, the itching will become more intense. Other common symptoms of pubic lice include low-grade fever, irritability, lack of energy, pale bluish spots near the bites. Excessive itching may cause wounds or an infection in the infected areas. Children with lice infestations on their eyelashes are also at risk of developing pink eye. Now, how do you diagnose pubic lice? You can usually diagnose yourself by thoroughly examining your pubic area. You can use a magnifying glass to look for pubic lice if you suspect an infestation but can't see well enough to be sure. Lice are usually pale gray, but they can darken in color after drinking your blood. You're probably infested with lice if you see small crab-shaped insects moving in your pubic hair. Lice eggs are another indicator of infestation. These eggs are tiny, white, and are usually found around the roots of pubic hair or other body hair. You're going to have to call your doctor if you spot any pubic lice. If you have a pubic lice infestation, you're going to have to contact your doctor. So how do you get rid of the pubic lice? This treatment consists of decontamination of yourself, your clothes, and your bedding. Topical over-the-counter lotions and shampoos can be used to remove pubic lice from your body, right? This treatment could include RID, NYX, or A200. You're going to have to ask your doctor which products are safe for you to use, especially if you're pregnant or if you're breastfeeding or treating an infant for pubic lice. You may also need to wash your pubic hair if your lice infestation is mild. Right? Find out exactly how much product you should use and how long you'll need to leave the product on your skin. Prescription medications might also be necessary if the topical solutions don't work. Even after successful treatment, a few stubborn lice eggs might cling to your hairs. Remove any leftover nits with tweezers. Home remedies such as shaving or hot baths, they aren't very effective for treating pubic lice. Lice can easily survive ordinary soap and water, right? So if there are several people in your household who have contacted pubic lice, treat everybody at the same time. This helps prevent reinfection. You will also need to decontaminate your home. Vacuum the entire house and clean the bathroom with bleach solution. Wash all towels, bedding, and clothing in hot water and machine dry them using the highest setting. If you can't wash or dry clean a certain item of clothing, seal it in an airtight plastic sack for 72 hours. You might need some stronger medication if the lice survives these efforts. So just make sure you have products, right? Like Ovide, a topical lotion that you leave on the affected areas for 8 to 12 hours, right? Stromectol, a 2 pill dose that you can take orally. You might need a follow-up dose after 10 days. Lindane, it's the strongest and most toxic product among the commonly prescribed pubic lice medication. You only leave it on for 4 minutes before washing it off. Don't use this product on infants or on yourself if you're breastfeeding or if you're pregnant. So for pubic lice and eyelashes, you may be able to pluck the nits and lice with tweezers or a nit comb. But the best option for an infestation near the eyes is to seek a physician, because this physician might prescribe a special lice medicine suitable for this area. Do not use regular lice shampoos around the eyes. And if itching persists for a week or two as your body works through its allergic reactions to the bites, call your doctor if you notice swelling, skin discoloration, or drainage from wounds. To prevent lice infestations, you're going to have to avoid sharing clothes, bedding, towels with anyone who has pubic lice. Sexual contact should also be avoided until treatment is complete and successful. And once you've been diagnosed with pubic lice, you must inform all current and past sexual partners so that they can be treated as well. Well, we had a serious conversation today, and I think it's so important to talk about STDs. And we cannot forget that they are still out there and people are still dealing with it. And you might be dealing with it, but you might not be aware of it. However, if you go to your doctor, you should be tested. And see, a lot of people go to the doctor and they say, oh, I want you to test for STDs. Well, based on our conversation today, you have a good picture of some signs and symptoms that may be occurring in you. So actually take that to your doctor and say, look, this is what I got going on. This is what I'm experiencing. And I'm wondering if I could get tested for it. Because there are STDs that they don't test for in the regular STD test. A lot of them say, oh, we test for everything. Well, not necessarily. So you're going to have to find out if you have symptoms and they persist, something's not right. So you have to go until you get it dealt with. And yes, hey, a lot of you might be too embarrassed to tell an old partner that you have an STD and that they might have it too. Or you might not even have some of their contact information. However, I think it is incumbent upon you to take action is to properly inform a partner, a past partner, and a present partner. Now, hey, if you got a sexually transmitted disease and your partner doesn't have a sexually transmitted disease, there's something that you need to be discussing. And before you give that to your partner, you need to let them know. It's not fair for you to give it to them and have them deal with it. You have a right to protect them. And they might take you to court if they find out that you knew and you didn't tell them. I know it sounds crazy, but it does happen. It has happened before. Think of people who spreaded diseases, right? People who spreaded HIV to people and they thought they got away with it. No, they've actually been convicted of the crime. When you knowingly do something to harm someone, right, then you are liable. Okay, so I want you to be like the wise old bird and spread the word. This is the counselor. Take care of yourself, people.